Welcome to Care Team Conversation Podcast, sponsored by Curbell Medical, featuring clinical leader and fall prevention and patient safety awareness expert, Dr. Patricia Quigley. This episode, Dr. Quigley speaks with guest Rebecca Love, a nurse innovator, author, entrepreneur, and international speaker. Rebecca is also the Chief Clinical Officer for IntelyCare, President and founder of Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders, and the first nurse to be featured on the main TED Talks platform.
Well, I am so delighted for all of our audience that's listening to us today to be able to introduce you to a nurse extraordinaire, Rebecca Love. Rebecca Love, as a nurse nurse innovator, a connector, an author. She's a scientist. Miss Love, I can't thank you enough for being with us, for being with me. This is my first opportunity to meet you and learn from you, as I know from many of our audience who's listening to us. So as we launch this session with Care Team Conversations, I'd love for you to share with our audience your initial journey into nursing to become a nurse and to become a nurse leader. Would you like to share with us, introduce yourself there, Rebecca?
Patricia, thank you so much for having me and just for giving a voice to nurses on your podcast and your listeners. And I, as you mentioned, I have been a nurse now for about 15 years. Nursing was a second career choice for me. I thought I was headed off to law school when my mom sat me down at a dinner and said, we're not going to support you going to law school. We think you should become a nurse. And she had gone back to school late in life to become a nurse. I was a freshman in college when she called me and said, am I too old to become a nurse? And I said, no, Mom, you can go back to nursing school. No idea that about 6 years later that statement and that conversation would come back to bite me. To say that after she joined nursing, she recognized that there were a lot of strong leaders in law, but not enough strong leaders in nursing. And she really needed strong women to go into nursing to lead the profession forward, because even what she saw nearly 20 years ago in nursing was that there was not enough nurses with a seat at the table to drive the changes they needed in healthcare. And so that's sort of the background of how we got started. But my whole journey across nursing was, as I said, second degree. I went on, I spent both time working as a nurse by the bedside, from med surg to the emergency room, to becoming a nurse practitioner, to work in hospice and cardiology. And my love actually fell into place when I became a professor at a community college. That also then spun out my first business that got me onto the business side of healthcare. And the rest sort of has transcended in regards to how do we get nurses to drive more healthcare leadership? And it ties literally back to hackathons for me. So it's sort of this experience of where life thought you were going to go. And then when, as everybody says, life happens to you when you're making other plans. And here I am today.
Oh, that's so wonderful, because I know nursing is better because of you. I, in contrast, always wanted to be a nurse. I've been a nurse since I was 3 years old. So my great aunt was actually born when Florence Nightingale was still alive. So, so I always felt connected to flow. So that's the difference. But yours is so extraordinary. And you know what, Rebecca? You mentioned that word hackathon, and I bet no one has heard of that unless they've read and viewed your work and viewed your podcast. So thank you so much for sharing your journey and the number of nurses I'm sure you've already been able to influence in your career and the specialties that you've worked in. You've had so many firsts in your careers, as I've researched about you, and I would love for you to share with people in your career that led you to the national stage, the world stage. You had this different view of workarounds, and that's what brought up this hackathon. Would you share with our audience about your view of workarounds?
Oh my gosh, Patricia, happy. And as you know, as you being a nurse and your great aunt being tied to Florence Nightingale, nursing really came all about because of workarounds, right? Things that were not established, that weren't working well to save patients' lives. Like the foundation of nursing all came down when Florence Nightingale basically said, look, medicine has it wrong. And we should really look at, the spread of infection from patient to patient to differently and sterilize equipment. So really the foundation of nursing started with challenging conventional medical practice and trying to make it better for outcomes for patients. But to your point, how did these ideas sort of start and hackathons start for me in Workarounds? Is that I always witnessed when I was on the floor of the hospital, most specifically, that nurses, every device we touched didn't do exactly what we needed it to do. So often we were working with systems that we were told create less work for us, but actually created more work for us. So nurses started to innovate on how they could do these things faster. Now, as you know, workarounds at like Google or Amazon, those are considered good things because you're making better user experiences. But in nursing, that is a really negative thing to do, right? Because there's two things you're not supposed to do as a nurse, Pat. What do you remember back in nursing school? What was ingrained in us? Like two things you never want to do as a nurse. You never want to kill patients and you never want to harm patients, right? That's the baseline as nurses. Don't harm patients, don't kill them, right? So because of that, we follow protocols and procedures. To your point, medication administration, we follow these protocols and procedures because they're supposed to save patients' lives, right? But what we find is that so much of what was brought into healthcare just didn't work for nurses, right? It was designed for a whole bunch of, by a whole bunch of businesses and healthcare systems that never brought the nurse into that conversation. So I had a small fledgling company back in 2016. A friend of mine said, Rebecca, go to this hackathon. And I said, to your point, like nobody knows what they are. I said, what is a hackathon? And he said, 3-day event. People come together, pose problems they want to solve, form a team, and over the weekend, they throw caution to the wind and bring a whole bunch of different ideas together on how to solve it. And I have to tell you, this weekend transformed the way that I looked at nursing, at healthcare, and the value nurses brought to this stage, because I was the only nurse at this event. And by the end, every single healthcare team was coming to me and saying, Rebecca, so what really happens with nurses on the floor? How can we do it better? And that's when I left and realized there has to be a nurse hackathon, because we constantly are MacGyvering. We're constantly making workarounds, but nobody allows us the opportunity to do it safely. And hackathons allow a really safe space for nurses to innovate, do those workarounds, and try out to see if they can move the needle. So that's sort of those ideas of workarounds. On average, nurses do 27 workarounds a shift. Well documented. So basically we live that definition of insanity, right? Doing the same thing over and over, trying to expect different results. But if you just listen to the nurses, like they would tell you how we could do it better.
That is just so fascinating how you actually turn that around, because you're right. So many times workarounds were seen as negative. And it wasn't the novice nurses who did workarounds, because novice nurses follow the rules. They don't have enough experience to know how to do things differently. And then there's the experienced nurses modifying things how they should be done. And I think it's probably very interesting what things could be modified in an innovative way versus what things really should be sustained without deviation from a protocol. So I'm sure that that's really very interesting to really differentiate that.
Well, Patricia, you hit the nail on the head. Like the truth is that today, more so than ever, healthcare is complex, but our nursing workforce is at risk unlike anything I've ever seen before. Not only because of COVID are they leaving, and we're expecting 500,000 additional nurses to leave the bedside by the end of 2022, moving that 1.1 million nursing shortage that we thought would hit in 2030 to potentially hit by the end of this year. And, we're talking about burnout, and we're talking about stress at work, and we're talking about all of these things. And what I think we fail to recognize is nurses often work in a system where they feel unheard and unvalued. And why you feel unvalued is because you keep dealing with these systems that, to your point, as you get more experience, you recognize it could be so much more efficient if you would just hear us and make these changes and create an environment that worked better for nurses who, in all honesty, the reason patients are in hospitals or nursing homes is not because they need to see a doctor or an occupational therapist or a physical therapist or get surgery, for goodness sake. All of that can be done outpatient. The reason patients are in hospitals or long-term care today is because their life is so at risk that they need a nurse 24 hours a day, 7 days a week, monitoring their life to keep them alive. And
Absolutely.
what we never did was build a system that worked for nurses to do that well.
Absolutely. I so agree with you. Absolutely. Nurses have to be involved in all levels of decision making and be allowed to really experience the ability to be able to think differently and go beyond. I always said that I wish I had invented Velcro, but I didn't. But,
I had so many nurses say, hey, this was my idea. Like, I
yeah.
said that. And I would tell people we should invent this. And everybody was like, yeah, that was really nice that you did. But the
But you
reality
gave the idea to someone else.
yes, how many nursing ideas have led to other people's inventions? And we know that there are countless, hundreds of examples of nurses who said, I came up with that on my floor. I promoted that, or I talked with that industry about that. And suddenly it was designed, but nobody gave nurses that business school, entrepreneurship pathway to say, hey, you know what? Actually, if you come up with an idea and execute against it, this could be your business. Like, you could do this. And imagine how many solutions out in the marketplace to major problems, because nurses innovate when there is a problem that's affecting a patient's life, right? The reason nurses innovate is not because they want to make money. They literally are innovating because it saves patients' lives, or it alleviates suffering, or it helps their colleagues.
Yeah,
and
absolutely.
I just think to myself, if we just allow, why I run hackathons today, if we just let nurses solve these problems, so much in healthcare would be better.
Absolutely. I'm so with you. And what a wonderful weekend you had in 2016 to transform your contribution and your leadership. And that takes me to another first of yours. And that first back in 2018 was a time when you were invited to the TEDx conference to be able to present. And I looked into this, Rebecca, and I realized as I explored this is that not everybody might know what TED is, but for our audience, TED is Technology, Entertainment, and Design conferences, the Innovators. And I saw that it's been around since 1984, and you were the first nurse. It took 30 some years for you to get there. So tell our audience about that, what that experience was for you to be the first nurse at the TED conference. And that was in 2018.
Yeah. That is a, wow. When you say it like that, that's a really interesting way to put it. I just remember this TEDx experience. And TEDx leads to TED because you have these independent stages. TEDx has been around, right? Lots of nurses have been on TEDx stages. None still to this day outside of my TEDx has gotten to the TED level. And why is that, to your point? So I remember I was talking to people about nursing, very similar to you, and this person that represents an organization now called Boston TEDx, but was Beacon Street TEDx. And Rebecca, you really should talk about nursing to our audience. Like, this is fascinating. I never knew nursing was so complicated, or that healthcare was going so complicated. And I remember they gave me a coach and we started speaking, and getting ready for a TED Talk is literally months of work, like every day, because you have to have it memorized. You have to have your talk track. You have to make your presentation. And it was so much stress. And I remember as I was getting closer to that event, I looked at the lineup, and it was the person who invented the micro engine out of MIT. And it was like the head of state for a country. And I'm sitting in my room with my daughter's been a big influence in my life. And she's listening to me every night do my speech. I'm like, can you just look at this and tell me what I need to do? And I remember one night I looked at her and I said, Colette, I can't do this. Mommy's not supposed to be up on that stage. Like, nurses don't go up on that stage. I don't think I should really go up and do this. And I remember, and she goes, no, Mommy, I really like your talk. And so I remember getting to that event. My mouth has never gone so dry. Like, if you had given me a cracker, I would have exploded and suffocated on it. Because the reality is, I stepped into this room, onto this stage, following some of the most famous people around the world who had just talked. And I thought, okay, I have to do this for our profession, because other nurses have to know that they can do these things. And I have to tell you, it was an extraordinary moment, because you stand on that stage with those spotlights in front of you and the room goes quiet, and you start and you hope that what you're going to say, which is highly complicated, because if you're not a nurse, you don't really understand what we do. Nobody really understands what we do, our problems. And I just hoped that the story that I outlined would make sense. And I remember certain people started laughing at times of my story. And then certain people started clapping at other points of it. And I remember I came to the end and everybody started clapping and half the audience stood up. And I looked down at the corner of the room and standing there was John Warner, the founder of Beacon Street TEDx. And he looked at me and he looked back at the audience and he looked at me and he started clapping. And he called me 2 days later and he said, Rebecca, the committee that did this decided out of all of the talks, we were going to nominate your talk to go on 10. And I have to tell you,
goodness,
it's honestly,
you give me goosebumps.
And you know what? How many times as nurses, we feel as imposters in the room that we're not worthy to be there because we're just a nurse. I can't thank the Beacon Street TEDx and John Warner because he did something for me and I hope the profession that I'll never forget. So, yeah.
Well, I thank you for saying yes. And one of the things that I always do when I talk to nurses, Rebecca, is I tell everyone to take the word just out because there is no just nurse. You know, you are a nurse, you are a nurse, you are a nurse. And, you know, that is just so exciting. And I've watched that podcast. It is extraordinary. I hope all of our listeners who are listening to you actually look at that podcast as well as this one, of course. But, you know, in 2020, in building on your career, you really did challenge organizations. You challenged organizations to escalate momentum in nursing. And I read about this in one of your writings. And you said that there were 3 things that organizations must do. And out of those 3 things, I was hoping that you would inform our audience what that is, because I believe that there's still opportunities for organizations to move forward with that.
Absolutely. So I think that when you're looking at organizations, nurses are the largest workforce of any healthcare system, regardless if it's in hospitals or if it's nursing homes, it's nurses or nursing assistants that make up that one. And the truth is that we need to encapsulate a better way to bring them to the table. Now, the challenge with what you probably know is that nurses historically, not even historically, they are a cost center to institution. So they have been rolled into room rates. And what that means is because they're a cost, everybody tries to de-invest in them. And what I keep trying to stress is that we can't keep treating nurses simply as this commodity, a cog in the wheel. So you must create new ways to engage them, empower them, but more importantly, value them. So do you create platforms where they have leadership pathways to get up to the top? Do you create innovation committees that allow nurses to bring these ideas and these workarounds together to do things differently? Because the truth is there's a lot that we can do. Now, what stood out to you that, you know, from what we were talking about, that you're like, this is something that the audience needs to understand better from 2020 was an incredible year for all of us in healthcare, but very much in that direction.
What stood out for me is that their voice matters. Their voice matters. Their voice has to be at the table. I've even said that for everything COVID. There should not be any decisions being made now in healthcare that's related to COVID without a nurse being at the table. And that intelligent work to be able to rely on expertise when everyone focuses on evidence-based practice, that expertise is a level of evidence. So voice matters.
Well, you're hitting it right out of the park. We know that with all of this knowledge leaving, right? All of these nurses retiring, infections are up, sepsis are up, medical errors are up, outcomes are worse for every patient in every setting today. Mm-hmm. And we constantly sit there and we're like, oh, well, you know, technology can replace that. We have all these systems. But what we're starting to fundamentally understand is there is no replacement for the nurse. I mean, there was a study that came out in Stat News of an article that was recently shared that said over 18 studies showed that nurses could recognize fatal complications before there are changes in vital signs. Mm-hmm. The best monitor of patients is nurses. Mm-hmm. And if we don't start investing in them, if we don't start seeing them not simply as a cost, where ratios of 1 to 8 mean the same of reimbursement models of 1 to 4, so hospitals are always going to staff to 1 to 8 ratios to save money, the reality is that resource is going to disappear. And the truth is, I think the next 5 years of nursing are going to be incredibly painful. Because I don't know how we reverse the trends right now. I don't know how we do that. So I'm glad that you're seeing it the same way that, and that it resonates, because just giving them a voice to feel heard, valued, and appreciated, you start to change their ability to stay vested where they are.
Absolutely. And I imagine in your capacity now for the last 8 months as the Chief Clinical Officer for IntelyCare, that you have really challenged organizations to find those solutions to have an intelligent workforce management group in facilities. Could you share with people a little bit about that?
Yes. IntelyCare is interesting because when the CEO called me now about 9-10 months ago, he must have caught me on a bad day because I said, you guys, every single agency, every single hospital, every single nursing home, you all treat nurses, you all have it wrong. You keep thinking that nurses are an endless supply of resources and that their life, their dreams, their hopes, their aspirations don't matter. You treat them simply as a disposable form of a workforce. That doesn't mean you have to invest in them and value them. And so called me back and he said, I was thinking about asking you to be on an advisory board, but what if you joined us to try to change the future of work for nursing? And I remember saying to David and saying, you mean you're going to give me all the resources that I could use to really try to change the way that nurses work today? And he's like, this is what our platform does currently, and we need to get better. And so the last 8 months have been an incredible time to look at what's happening in our workforce, right? And what nurses want. And you know this, Patricia, every time we left a shift, we would be called back in. What did you miss? What did you forget? Can you work your time off? I actually need you to work night shifts next weekend as opposed to your day schedule. Like, the reality is there was no time for nurses to be able to have a life. And I know this feels weird, but people I don't think understand that nurses are scheduled often for 3 to 6 month blocks. They can only take 1 week of vacation, one time a week in the summer and one time in the weekend in the winter. You can't take those together, right? Like, this is crazy. And if you want time off, say your son's birthday is coming up, you put in for a request, it's likely denied, and then you have to find your own coverage, right? Like, we've created a very punitive environment that basically tells the employee, the nurse, the CNA, that anything outside of their work schedule is irrelevant to their needs. Mm-hmm. And that means if you're sick or if your child's sick or anything, and I think you know this, the reality is what I've been able to look at what we do at IntelyCare is through technology, you can learn behavioral insights about nursing that they think they're signing up to do per diem once in a year shifts. Suddenly they're working 4 or 5, 6, 10 shifts a month with you because you've made it so easy for them to pick up a schedule that works for them. And in other ways, we've also learned that through AI and data, we oversee 3,000 healthcare facilities, and we can actually predict their needs well in advance so that they can staff more accordingly so that they're not burning out their own workforce. So one of these things that I think is just a basic thing that nobody has ever invested in was give nurses technology in a way that empowers what we refer to as a nurse-life balance. And you're going to get them working far more and superior and happy than how you treat them today. And I don't know if that was the same experience for you in nursing, but there are some challenges how we currently treat nursing and scheduling and shifts. And we're trying to turn that on its head.
Oh, absolutely. And I tell you, I think every nurse has those same challenges. Absolutely. But nurse life balance has been a need forever. So I'm so glad that you have taken the leadership to really be able to transform that and help it to be raised to a priority. And another thing that I'd like for you to be able to share with our audience, which I just think is so exciting, is this organization. All of your work is so exciting. This organization that you've been president of since 2019, and it's called SONSIEL. Is that how we say it?
SONSIEL.
Yeah, it's the Society for Nurse Scientists and Innovators and Entrepreneurs and Leaders. And who doesn't want to belong to that? It's like, oh my God.
I would love you to be a member, and I would love anybody to be a member that wants to join us. Yes.
So I know that you're committed in this group to magnifying and creating networks and elevating expertise and nurse innovators. That is just so exciting. Could you just share with everyone a little bit about that?
Yes. After I left Northeastern and transitioned out of being the director of innovation and entrepreneurship there, which was the first of its kind in the country to talk about nursing and education, like, oh my gosh, we can teach them about this stuff. Recognizing that I had met so many awesome nurses who had walked the life differently, right? The chief nursing officer of Microsoft, all these heads of incredible nursing-led companies that nobody ever told me about existed. And we founded SONSIEL in 2019 when a group of us came together to say, things have to change. And the typical progression of nursing is not, the way that it currently is designed is not going to continue to attract the best and the brightest into nursing, right? The salaries are a capitated model. Not everybody wants to stay, and especially this next generation, the idea that they want to work the first day of their job could look exactly the same as 30 years later on the same floor, that just does not have appeal to the generation that's coming behind us, right? Mm-hmm. So we came together to say, we have so much incredible knowledge. So many nurses who have walked life differently are leading major organizations, healthcare companies, healthcare systems, Partners in Health. The CEO of Partners in Health, Sheila Davis, is a founding member of this. There are just incredible nurses who walk life differently. And we came together in 2019. We wrote a book. COVID hit. And what happened is we started to do meetups. Nurses from around the country started to call in and say, this is what I'm doing. There's not a doctor to be found on this hospital floor. We're by ourselves. And flip a patient over to their stomach because you're going to be able to increase their oxygen. So if somebody walks in and they're walking and talking to you, you're going to put a pulse ox on them and they're going to be at 76 and you're going to be intubating them in an hour. Here's how we run IV tubing from outside the hall so that we don't have to go to. Here's how we're making our own PPE because there was no PPE, right? And so that's when I called Molly McCarthy at Microsoft and I called Linda Benton at J&J and I said, you guys, nurses are innovating in COVID. Nobody's supporting them. We got to do a hackathon. And that's when we started to run biannual hackathons since May 2020 with all of these nurses on the front line. We raised $100,000 to move 300,000 pieces of PPE around the country alongside a Glow Good Foundation, a dental organization. But it is just an organization, and really, I'm a strong believer, a rising tide raises all boats. And I really believe those members of it, unlike you hear of nurses eating their young, I really believe they believe in paying it forward. And if we can get supporting more nurses coming and doing talks like this, or introducing them to be on the stage somewhere else, or being part of a book or an opportunity to be heard, we're going to change how nursing is viewed in healthcare. And that's what we do. That's what we're working on. And the next president's coming in. I'll have to introduce her. She's actually the head of innovation at Mass General Hospital. She's taken over SONSIEL at the end of 2022. And it's just exciting to see that it's going. We have 800 nursing organizations in the world. And I wasn't sure we were gonna do it. And we are.
Well, we're spreading the word about your group now. And I know that through this podcast, that there'll be so many people so excited by you and learning about this organization that I know that this organization will grow. Well, I just can't tell you how exciting it's been to just spend these few minutes with you. I could talk with you all day and probably more.
It's just so great to also connect with another nurse and have this conversation. So it's amazing. Thank you.
And my world is falling for injury prevention. And I don't know that I'm an innovator, but I'm the nurse who won't give up on orphan issues. So, that's my legacy, but I would just love for you to provide some closing remarks to our audience as we come to a close, Rebecca. It's just been such a delight.
Patricia, there's one thing I can leave with your audience. There are two questions that I would ask them to pose. One to their employer if they work in healthcare, to say, where is our chief nursing officer? Do we have a nurse at the top of leadership? And if we don't, why not? And let's make sure to commit to it. And two, the next time you're in a hospital, I think you need to ask that nurse, how many patients are you caring for? Because the reality is our nurses are getting vastly burnt out. And we know that for every additional patient over 4 or 5, the increase of death goes up by a minimum of 7% across all of those patients. And that when you go from a ratio of 1-4 to 1-8, that death rate goes up to 32% increase within those patients being managed by that nurse. And we need better attention to be drawn to the role of the nurse and the support of the nurse. Because if we keep going, what will happen if they all leave? And we need to all lean in and support this nursing workforce, because I'm just like you, Patricia, look around you. What would the world be if our mothers or our aunts or our neighbor or our friend had not been a nurse? Who would they be today? And what would our world look like if they weren't in society today? So let's commit to investing, valuing, and empowering the profession.
Oh, I am so with you. I'm going for 100
Love it.
years in nursing. It's all I ever want to do. And I'm so grateful that your mother helped you to think beyond being a lawyer, even though you could have been a nurse attorney. I know some of them. But
they're amazing. Maybe in another life or in another, who knows?
Oh no, thank goodness your journey took you to where you are, because you're so inspiring. And Rebecca, I can't thank you enough, all of us, on behalf of Curbell Medical, on behalf of the nursing profession, on behalf of the patients who we care for. That's what it's all about. Is we thank you for sharing your time, your dedication to elevate nursing's influence and impact. You've positioned yourself, Rebecca, because there's times you could have said no, but you went forward, and you have positioned yourself to be a pole star, to inspire innovation. And you are applauded. You are applauded, Rebecca. So thank you so much. And as I close, I would like to make sure, and if you don't mind, I'm going to put a plug in for your SONSIEL conference that's coming up. I know there's a conference coming up at Drexel University, and that's going to be in Philadelphia, the 30th of April to May 1st. And I'm sure you'll share that link so that can accompany the podcast, and have some more people to join you there for that weekend of incredible innovation and excitement.
Well, thank you so much for doing it. It's the Drexel and Santiago Nurse Innovation and Entrepreneurship Certificate. The good news is it's all virtual, so you actually don't have to get to.
Oh, there you go. Okay.
Even better. And we would love you to come because it's going to be like a weekend of education that nurses have never seen before. And anybody actually who perhaps hasn't got exposed to business and healthcare, of course, is welcome to join us. So thank you for saying that.
Oh, you're welcome. Well, it has indeed been my pleasure to be with you, to learn with you, and be inspired by you. Thank you so much, Rebecca. Thank you.
It was an honor being with you. And thank you to Curbell for having us participate today. So thank you.
Thank you for listening to Care Team Conversation Podcast, sponsored by Curbell Medical. A special thanks to our guest, Rebecca Love. We greatly appreciated you sharing your story as pioneer in nursing innovation, an advocate in nursing empowerment, and becoming the first nurse to be featured on the main TED Talks platform. Thanks to our wonderful host and patient safety expert, Dr. Patricia Quigley. For more information about Rebecca Love and her work with Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders, IntelyCare, or her TED Talks presentation, please see the links in the show notes. For more information about Curbell Medical and our innovative products, please visit curbellmedical.com. You will be able to find this and future podcasts on the Curbell Medical website or wherever you listen to your favorite shows.